the $2 remedy that clears skin tags, warts, and growths. Dermatologist-approved steps. Look down at your skin right now. If you have a skin tag, a wart, or any kind of small growth that has been sitting there for months or years, there is a very good chance you have already Googled how to get rid of it, and there is an equally good chance that Google took you down a rabbit hole of weird home remedies, expensive dermatologist visits, and a lot of conflicting information. So here is something I want to say right at the start. Most of what people do to try to remove these growths at home is either completely useless or honestly a bit dangerous. But there are a small number of approaches that are genuinely supported by evidence that are safe and that cost almost nothing, and one of them costs less than $2. Hi, I'm Dr. James Whitfield. I'm an emergency medicine physician. I have been working in the ER for just over a decade. And in that time, I have treated more than 40,000 patients. And what I keep seeing, what I see every single day, is people who have waited too long, who have tried to manage something themselves without the right information, and who have ended up in front of me in a much worse situation than if they had just understood the basics earlier. This channel exists because of that. My mission is simple. I want to give you the knowledge to protect yourself before you ever need to sit across from me in the emergency room. In this video, I am going to cover exactly what skin tags, warts, and small skin growths actually are at the biological level, because most people have a completely wrong picture of what is happening under the surface. I am going to walk you through which ones genuinely need a doctor and which ones you can safely address yourself. I am going to explain the evidence behind that $2 remedy in real detail, not just someone on the internet said it works. And at the end, I am going to give you a practical step-by-step framework you can actually use. Not vague advice, a real plan. Now, before I get into it, a quick and genuinely humble ask. Only a fraction of the people who watch these videos have actually subscribed to the channel. And this channel is entirely about giving you free, medically accurate information that your primary care doctor often does not have time to explain. If you find this useful, please subscribe. It genuinely helps this content reach more people who need it. And I promise, if you get to the end of this video and you did not learn something new, you can unsubscribe with absolutely no hard feelings. All right, let us get into it. The first thing to understand, and this is where most of the confusion starts, is that skin tags, warts, and other small growths are not the same thing. They look similar to the untrained eye. They both sit on the surface of your skin. They both feel like something that should not be there. But the mechanisms behind them are completely different, and that matters enormously when it comes to treatment. A skin tag, the medical term is acrocordon, is a small soft outgrowth of normal skin. It is not a virus, it is not an infection, it is just a tiny flap of skin, usually a few millimeters, that has grown outward from the surface. They tend to appear in areas of friction, so your neck, your armpits, under the breasts, around the groin. What we know is that they are strongly associated with weight gain, insulin resistance, and something called metabolic syndrome. That is the cluster of conditions, including high blood sugar, high blood pressure, and abnormal cholesterol, that puts you at much higher risk of heart disease and diabetes. Now here is where it gets really interesting. Several studies have found that people with multiple skin tags, not just one or two, but several, have significantly higher rates of insulin resistance than people without them. There was a study published in the Journal of the European Academy of Dermatology showing that skin tags can actually be an early skin marker of metabolic dysfunction. So if you have a lot of them appearing over time, that is not just a cosmetic issue. That is potentially your body giving you a signal worth paying attention to. A wart, on the other hand, is a completely different beast. Warts are caused by the human papillomavirus, HPV. Now, when most people hear HPV, they immediately think of the strains linked to cervical cancer. But there are more than 200 strains of HPV, and the ones that cause common warts on your hands and feet are almost entirely harmless from a cancer risk standpoint. What they are, though, is a viral infection living inside your skin cells. The virus essentially hijacks normal skin cells and makes them replicate abnormally fast, which is what creates that rough, raised surface you can feel. They spread by direct contact, which is why they tend to come back even after you remove them if the virus is still present in surrounding tissue. And then there is a third category that I want to flag separately. These are the growths that you absolutely should not try to treat at home. A seborrheic keratosis is a very common, completely benign growth that tends to appear with age. It looks a bit like a wart, but has a very distinctive, stuck-on, waxy appearance. These are harmless. But here is the problem. A melanoma, a serious form of skin cancer, can sometimes be mistaken for a seborrheic keratosis or a dark skin tag. The thing is, most people cannot tell the difference. So before I go any further, let me give you the simple check you should do before attempting to treat any skin growth yourself. Dermatologists use what is called the ABCDE rule. A is for asymmetry. If you draw an imaginary line through the middle of the growth, do both halves look the same? If not, that is a concern. B is for border. Are the edges smooth and defined, or are they irregular, ragged, or blurred? C is for color. Is the color uniform, or are there multiple shades, dark patches, or areas of red, white, or blue within it? D is for diameter. Is it larger than about 6 millimeters, roughly the size of a pencil eraser? E is for evolving. Has it changed in size, shape, or color recently? If any of those 5 things apply, please go and see a doctor. Do not try to treat it at home. Do not put anything on it. Book an appointment with your primary care physician and let them take a proper look. Skin cancer is almost always treatable when it is caught early, and it becomes far more dangerous the longer you leave it. Assuming you have done that check and you are dealing with a routine skin tag or a common wart, here is where we can start talking about what actually works. Let us go through the main options in order of evidence strength. Number 1, and this is the $2 remedy, is salicylic acid. Most people know salicylic acid as an ingredient in acne products, but at higher concentrations, typically around 16 to 17%, it is one of the best studied over-the-counter treatments for warts that we have. It is available in pharmacies as a gel, a liquid, or an adhesive pad, and a standard bottle costs between $1 and $2 in most places. Here is the mechanism. Salicylic acid is what we call a keratolytic agent. Keratolytic means it breaks down keratin. Keratin is the structural protein that makes up the outer layer of your skin. By breaking that down, it gradually removes the infected tissue layer by layer over several weeks. It does not kill the virus directly in a single application. It works by stripping away the environment where the virus is living, forcing your immune system to engage with deeper, healthier tissue. There was a Cochrane review, and for those who do not know, a Cochrane review is essentially the gold standard of medical evidence, a systematic analysis of multiple randomized controlled trials. That review found salicylic acid to have a cure rate of roughly 73% for common warts, which is honestly comparable to cryotherapy, the freezing treatment you get at a dermatologist's office, when used consistently over a period of 12 weeks. The key word there is consistently. Most people give up after a week or 2. That is why it seems like it does not work. The evidence says it absolutely does, but it requires patience and repetition. Number 2 is cryotherapy. Now, proper cryotherapy uses liquid nitrogen at minus 196 degrees Celsius, and that is done in a clinical setting. But there are also over-the-counter freeze sprays, products like Compound W Freeze Off, that use a mixture of dimethyl ether and propane to reach much colder temperatures than a standard freezer, but not as cold as clinical nitrogen. These are moderately effective for small, superficial warts. The mechanism here is different from salicylic acid. Cryotherapy kills cells directly by forming ice crystals inside them, which ruptures the cell membrane and destroys the tissue. When done properly in a clinical setting, it also triggers a local immune response that helps your body attack the virus in surrounding tissue. The limitation of over-the-counter sprays is that they simply do not get cold enough to penetrate deeply, so they tend to work better on small or flat warts than on thicker plantar warts, the ones on the bottom of your feet. Number 3, and this one surprises people, is duct tape. I know, it sounds like something from a DIY forum rather than a medical recommendation, but there was actually a randomized controlled trial published in the Archives of Pediatrics and Adolescent Medicine, which is now the journal JAMA Pediatrics, that compared duct tape occlusion therapy to cryotherapy in children with warts. The duct tape group had an 85% success rate compared to 60% for the cryotherapy group. Now, I want to be honest here. There have been subsequent studies with less impressive results, and the exact mechanism is still debated. The most accepted theory is that the occlusion, meaning covering the wart, creates a local irritation that stimulates the immune system. The constant mild irritation essentially flags the area for immune surveillance. The method used in the trial was simple. Cover the wart completely with duct tape for 6 days. Remove it, soak the area in water, gently debride the surface with an emery board or pumice stone, leave it uncovered overnight, and repeat the cycle. It is worth trying, particularly in children, because it is completely painless and costs almost nothing. Number 4 is what I want to say about skin tags specifically, because salicylic acid and cryotherapy are primarily studied for warts. For skin tags, the most commonly used at-home approach is tea tree oil applied consistently over several weeks, or very small tags can sometimes be addressed with a compress of apple cider vinegar. Let me be really honest here. The evidence base for both of these is much weaker than for salicylic acid on warts. The studies that exist are small and not well controlled. What does have good evidence for skin tags is ligation, which means cutting off the blood supply by tying a very thin thread or a purpose-built device tightly around the base of the tag. The most evidence-backed option for anything larger than a couple of millimeters is honestly to see a dermatologist. A skin tag removal in a clinical setting is a minor procedure that takes about 5 minutes and is often covered by insurance if the tags are causing discomfort or irritation. For very small ones, ligation devices like TagBand are available over the counter and work on sound mechanical principles. Number 5, and this applies to both warts and skin tags, is immune system support. This is the one that most videos completely skip. Here is the thing. Your immune system is ultimately what clears these. The human papillomavirus that causes warts lives in your skin, and your immune system is constantly working to suppress it. In most healthy people, the immune system will clear a common wart on its own within 2 years, even without treatment. But in people who are immunocompromised, under significant chronic stress, sleep-deprived, or nutritionally deficient, that clearance is much slower or does not happen at all. There was a study published in the British Journal of Dermatology showing that chronic psychological stress measurably impairs skin immune surveillance. Zinc deficiency specifically has been associated with persistent warts. Because zinc plays a direct role in T-cell function, those are the immune cells responsible for identifying and clearing viral infections. Supplementing zinc at 20 to 40 milligrams per day has shown some benefit in small studies for recalcitrant warts that just will not go away with standard treatment. I always look at the whole picture. If someone is getting recurrent warts or skin tags that keep coming back, I want to know about their stress levels, their sleep, and their diet, not just what they are putting on the growths. Now, as I promised, here is the practical framework. This is the part most videos skip entirely. Step 1. Do the A, B, C, D, E check I described earlier. If any flag goes up, book an appointment with your primary care physician before doing anything else. This step is non-negotiable. Step 2. Identify whether you are dealing with a wart or a skin tag. Warts feel rough, have a cauliflower-like texture, and often have small black dots inside them. Those are tiny, clotted blood vessels. Skin tags are soft, smooth, and hang off the skin on a narrow stalk. If you are unsure, see a doctor. Step 3. For warts, start with salicylic acid at 16% or higher. Apply it every single night after soaking the area in warm water for 5 minutes. Gently file down the surface with an emery board before each application. Do this for a minimum of 12 weeks before concluding it is not working. Consistency is everything. Step 4. For skin tags under 2 to 3 millimeters that pass the ABCDE check, a ligation device like TagBand is a reasonable first step. For anything larger, or if it is in a sensitive location like near the eye, see a dermatologist. Step 5. Support your immune system. Prioritize sleep. Keep stress manageable. Eat enough protein and zinc-rich foods, things like pumpkin seeds, beef, and chickpeas. If you have multiple skin tags appearing, ask your primary care doctor to check your fasting blood glucose and your insulin levels. That is the systemic conversation worth having. Step 6. If nothing works after a genuine 12-week effort, please go and see a dermatologist. Cryotherapy in a clinical setting, electrocautery, or minor surgical removal are all fast, effective, and well tolerated. There is no medal for struggling alone. Let me zoom out for a second and leave you with the bigger picture. Your skin is not just cosmetic. It is the largest organ in your body, and it gives you signals. A wart tells you something about your immune system's current capacity. Multiple skin tags can tell you something about your metabolic health. These things on the surface are often windows into what is happening underneath. The goal of this channel is never just to treat the visible. It is to understand what the visible is telling you, and to address the root cause so that you are not just managing symptoms forever. That is true for skin, and honestly, it is true for almost everything. Thank you so much for watching. If this was useful, please subscribe. It genuinely takes about 2 seconds, and it helps this channel reach more people who need this kind of information. Leave a comment below telling me if you have ever tried any of these methods. I read every single one. And I will see you in the next video.